Let's now talk to epidemiologist Dr. John Wong. He is also the Senior Technical Advisor of Public Health Research Institute, Epimetrics. Good morning, Dr. Wong. Thanks again for joining us here on New Day. Okay, first we want to get your thoughts on yesterday's case number. That was 17,000 new cases yesterday, up from about 10,000 the day before. How concerned are you about this type of jump?
Well, I'm very concerned. As we know, the rising cases was due to the holiday gatherings last December, all the way up to January 1. So we should expect that cases will continue to rise up to mid-January. But after that, we know that there are also some upcoming super spreader events, like the translation of January 9 or the Feast of Santo Niño, Chinese New Year. If people continue to attend these super spreader events, we could see continuous increase in the cases. Another thing to worry about also is the speed of the rise. Looks very much like the signature of Omicron. Of course, we will need whole genome sequencing to know for sure. But the fact that we have doubling every 2 days. Yet less hospitalizations compared to the Delta wave, makes it look very much like Omicron.
All right. So you mentioned how there are fewer hospitalizations in spite of the rise in cases. So there are some experts or even lay people who are saying that we could all get Omicron and this will create herd immunity and this signals the end of the pandemic. What are your thoughts on that?
Actually, even before Omicron, herd immunity was no longer possible. The initial target of 70% vaccination was based on the transmission of the original strain. And it also assumed that vaccines would be 100% effective. So now we know that Delta is twice as transmissible as the original strain, and Omicron is 8 times more transmissible. We also know that vaccines, their efficacy wanes over time, and both Delta and Omicron are less susceptible to it. So all of these factors make herd immunity impossible. So I don't think we can achieve herd immunity. So the target should actually be 100%.
All right, 100% vaccination. Now, I want to talk about the behavior of the Omicron variant. Some have said, maybe you heard in the piece just before you came on, that the antibody from getting infected with Omicron acts like a natural vaccine and it can give some kind of protection against other variants. What do you know about this?
Well, we shouldn't call infections vaccines. First of all, you can't adjust the dose of that infection. If you get too little of the virus, you don't develop any immunity at all. If you get too much, you get hospitalized. Second, if you get Omicron, you're infectious to others, unlike vaccines, which are not. You can also be hospitalized from Omicron. So all of these characteristics make infection by Omicron very dangerous. I mean, if a vaccine does all of this, it would be withdrawn from the market right away, and the manufacturer will be sued. So we shouldn't call an infection a vaccine. And I encourage people not to intentionally infect yourself with Omicron. It's not going to be a vaccine.
Right, because it seems that the symptoms of Omicron are mostly mild, although we know transmission is extremely rapid. But the fact is, Omicron is still potentially harmful to the elderly and to those who are immunocompromised or those with comorbidities. Is this mildness of symptoms that we're seeing in Omicron, is that really the nature of this variant, or is it because so many people who are infected with Omicron are vaccinated?
It could be many factors. So it was first detected in South Africa, but South Africa has a very high level of immunity. No, they've had four very large waves. About 70% already of antibodies from infection, and about 25% from vaccination. So they're about 95% immunity. No, they also have a very young population. No? So the mildness could be due to some of these factors. No. But we need to wait for some more data. No? But initial data shows that it is milder, no? But not totally harmless. No? Hospitalizations still do occur.
All right, Dr. Wong, before I let you go, what are your reminders? What is your message to the viewing public? What should they remember and keep in mind as cases continue to rise?
Well, get vaccinated and boosted, no? Especially if you're elderly. Avoid the 3 C's, no? Crowds, close contact, confined spaces. Upgrade your mask, no? N95, KN94, or KF94. And if you get symptoms, no? Get tested within 24 hours.
All right, good reminders there. Thank you for your time this morning, epidemiologist Dr. John Wong.